My name's Dr Sarita Robinson and I'm the Deputy Head in the School of Psychology and Computer Science at the University of Central Lancashire. So I suppose what's quite interesting is that I've been worrying about a pandemic occurring for about 20 years, ever since I did my PhD. And so when I saw the warning signs that we might be facing a major pandemic, I think I maybe was a little bit more prepared than most people. I had a pandemic preparedness kit under the sort of sink, and I was able to bring out masks and wipes and disinfectant, etc. ready. But I think Workwise, it was very, very interesting in that we had 3 days notice that we were taking our entire degree course online. So I had to implement our 5-year digital plan in 3 days. So it's an interesting question to say, what would you do differently if this happened again? And I suppose one of the things that I've always been saying is that it's okay to be physically prepared, but we also need to be mentally prepared. And although I thought I was mentally prepared, I think I have definitely been on a Covid-19 roller coaster with the rest of the country. And I think that I would tell myself earlier what I already know, which is social support is really important. And actually getting on Zoom, getting on FaceTime, getting on Teams and just talking to people, friends, family, people you've not heard of for a long time, just having a chat with people on a more regular basis would be my best advice to my 6 months ago self. I do wonder whether people thought that just because I study this area, I should be more prepared mentally and physically than most people. And the truth is that that's not the case. Basically, you research things you don't quite understand. And so I think actually to stand up and say, yes, I found this difficult too, is actually a relief for other people to hear. So I'm very honest about my own response. And I will say, yeah, sometimes I have really bum days and some days I do fine, just like everybody else in the country.